So good morning, dear doctors and teachers and the support staff who are here. I'm going to talk on certain interesting development which is going to happen in the training program of allergy and asthma in AASC Caribbean. So I am Dr. B.V. Balachandra. I'm a consultant pediatrician and allergy asthma specialist. And I practice in Bangalore, India, and I work in Allergy Central Center of Excellence for Allergy and Manipal Hospital. And I have been thankful to God that I had an opportunity to train under Professor Dr. P.K. Vedantan, Dr. Vinay Mehta, sir, and under the able guidance of Dr. P.K. Vedantan, sir. We are able to start allergy asthma specialist course in India in 2001, and we have been successful in training about 546 allergy doctors in India from last 3.5 years. So now we want to bring in this allergy asthma training program to Caribbean countries. So basically, what is allergy asthma specialist course? So allergy asthma specialist course is a 9-month hybrid course on allergy and asthma. And this is a particular course which is completely, the course is, the 9 months content is completely recorded, animated course wherein a rich learning experience is made while learning. And there is a lot of effort which has been made to make sure that the interaction with the faculty, the students are maintained. And the whole course is available on your software, on the LMS, on your mobile, on your laptop, on your iPad, anywhere. I'll be talking about more details subsequently. So now, the question is, why is the need for allergy asthma training? Is there a need in Caribbean countries? I did some of the research studies, and I'm going to just put few highlights on that. This is an article released from BMJ 2012, which says that the prevalence of asthma varies from 17% in certain Caribbean countries to about 30% in Costa Rica. And about every fifth child in Jamaica has caught and reported wheeze or a self or a doctor diagnosed asthma. And the prevalence of allergic rhinitis, prevalence of hay fever and eczema among children is 24.5%, 25%, and 17.3%. That's a big number. That's almost like 1/4 of the children are having some kind of an allergy going on. There's another study which says that when a skin prick test was done among the subject population, about 50 to 81% of the subjects was tested as positive to one or other allergens, and there is a high prevalence of different kinds of an allergic diseases which is going on. That's a huge number. Even compared to the rest of the world, it's a huge number. So again, when we compare the standards of allergy training, let's take developed countries like Europe or USA, wherein there is about one allergy specialist for every 50 to 60,000 populations. And if that's the criteria which is being considered, then Caribbean countries, which has got a population about 44.8 million, needs about 897 allergy specialists. At present, what I've understood, okay, is there are very few allergy specialists who are trained in abroad or managing this huge population. And this also makes that there is a huge need for allergy specialists on this region. What is this allergy asthma specialist course, this Caribbean allergy asthma program? It's a 9-month course. As I told, it is a online course with a short contact session. These courses are available on your phone or on your laptop. It's a recorded animated content. Along with that, there is an 18 online Zoom contact sessions, and there are 3 days of personal contact sessions and 1 exit exam, which is important for certifying it. This course contains about 12 modules, about 34 chapters and a self-assessment after each chapter. And there's also, along with the course, there is a textbook of allergy for clinician, which is the latest edition, and a small set of allergens are given for practice. And most importantly, a library of 90 plus, now it is about 110 case discussions are available, which the last 5 to 6 batches, which is training has happened in India, those cases, those case discussions from the best faculty and the students' presentations are available to learn about the case discussions, the presentations, and the approach. Also, this course supports several documents which is required for your practice. It could be an allergy testing reporting form or an anaphylaxis or an action plan for asthma. So all the documents are supported, and there is a monthly course calendar which has been given so that you are well aware of what activity happens at what particular point of time. So, though it is an online course, an extensive effort is made to maintain the interaction with the faculty and the students. And then weekly, on a regular basis, weekly, twice or thrice, a WhatsApp poll, which contains several questions related to the subject, or it may be an aerobiology, it may be some kind of an allergy Q&A or an MCQs. So polls are run, and as I told you, the 18 online Zoom sessions, which involve several case discussions and Q&A sessions. Also, to make sure that the frequent assessment happens so that the sequential learning is appropriate. Every month, there is a test which may need about 20 to 30 minutes for a learner to spend time to answer the questions. And this becomes a part of an academic performance sheet. And every month there is a reporting format is there so that every learner understands at what stage they are, and if anybody is lagging, there is a communication with the faculty is being made, and if required, faculty can discuss and help them to make sure that they are on the path of good learning. The personal contact session, which is a 3 days of in-person session, is required. The whole course is 9 months, which is an online, both recorded version as well as a Zoom version. But 3 days of in-person session is required to teach an most important hands-on skill. Very practical aspects are dealt there. All the theoretical aspects are covered online. So the course also demands a minimum of 5 skin prick test performance, because the whole intention of doing this course is to make sure that the learner practices allergy while doing the course itself, so that there is a continuity maintained even after completing the course. So there is one theory exams at the end of it, exit exam, and there is a practical exam. Practical exam means, though it is practical, it is done online, but it involves the assessment based on the practical aspects of that. The credibility of the course comes from the certifying body. So the AASC Caribbean program is certified by Bridgetown International University from Barbados, International Asthma Services, and MedTrain. This course is endorsed by American Academy of Allergy, Asthma, and Immunology and Center for Global Health, Colorado School of Public Health. So that's the credibility of the course. This course has been developed by the best national and international faculties from USA like Harvard University, University of Colorado, Singapore, National University of Health Singapore, and from India, several centers from India. This is a huge list of the faculty who have built the course. So I would name few of the faculties like Dr. P.K. Vedantan sir, Dr. Vinay Mehta, Professor Harold Nelson, Dr. Murali, and many other doctors have put in their effort to build a very, very good content, a very, very good course. The faculty who will be responsible for having a regular connectivity with the learners are Dr. P.K. Vedantan sir, Dr. Kandamaran Krishnamurthy sir, myself, and Dr. Narmada, who will be your academic coordinator as well as a faculty. We have a very excellent advisory board who are going to guide us of the regional requirement. Dr. Steve Cowrie, lecturer in child health, Dr. Kirik Douglas, Director Center of Biosecurity Studies, and Dr. Arifa Alauddin, pediatric nephrologist and from Royal College of Physicians and Surgeons with expertise in allergy, Dr. Jennifer M. Knight, Dr. Jennifer M. Knight, Professor of Pediatric Pulmonology and Clinical Research, Dr. Angela Jennings, HOD Pediatrics and Lead Consultant, and Dr. Dwan Alien, MICU Consultant and Pulmonologist. Please forgive me if my pronunciation is wrong. So these are the images which is showing that previously this kind of a programs conducted in India and how successful it has been. Starting from July 21st, 2021. This is the first batch, second batch, third batch, fourth batch, fifth batch, and the sixth batch is a currently ongoing batch with 120 students learning. I would like to share a small study which we had conducted among how our students are doing after their training, and this was presented in World Allergy Congress, which recently happened in 2023. We wanted to know the experience of learning on this mobile app. 98.9% felt it is good or very good. This was graded into 5 groups. Score of 5 was considered as very good, score of 4 as considered as good, 3 as an average, 4 as below, 2 as a below average, and 1 as poor. So 98.9% had good or very good experience in the learning on mobile app, and about 96.45% had a good or very good experience on Zoom session, and 87.2% had good and very good on the social media like a WhatsApp or a media to use learning. 3-day personal contact session, about 100% of them felt good or very good experience of learning. The impact of allergy asthma training program was looked into. So about 91% of them felt good or very good of level of confidence in practicing allergy after the training. 87.72% of our doctors are performing skin prick test, and 56.14% of them are practicing allergen immunotherapy. And the last question, and a very important question, what we assessed was, because most of the doctors were practicing pediatricians or ENT or otolaryngologists or pulmonologists or respiratory medicine or physicians, they did not have a complete time to dedicate and do any other course. So we asked them a question whether there is a need for hybrid-based allergy asthma training program, and 92.86% of them have mentioned that without an hybrid training program, they would have never done an allergy asthma, or they would have never upgraded their knowledge in allergy and asthma. So this is a course which will be launched in Caribbean countries. 21st of July is this course is going to go live. And I think the applications and the brochure is already released. I'm sure many of them would have received it. If not, you will be receiving it. And I'm sure that my team would be putting a link on the chat box where you can go directly to the course page. And 21st is where the course will actually start. So it's about the course. Thank you. Thanks for giving me this opportunity and sharing of what is being achieved in India. And hopefully we'll be able to do the same thing in the Caribbean islands. Thank you.